Health literacy matters because it influences people's ability to take control of their own lives and to manage their own health issues. People with higher levels of skill on our health literacy scales have better access to better jobs, experience less unemployment, are much less likely to injure themselves or experience an accident at work, and when they do encounter disease or illness, they're able better to manage that. Those differences aggregate up to differences for the performance of social institutions like hospitals, and in fact have huge impacts on the quality of life and the social development and economic development. People with higher levels of health literacy have agency and control over what happens in their lives, not only in their health domain, but also their engagement with work, their engagement in the community, their access to educational opportunity. So finding ways to increase the supply of health literacy will reduce the burden of disease and the cost of disease for taxpayers, and also improve quality of life for individuals.
I believe health literacy is one of the most powerful tools we have to create a healthier nation and world. It involves individuals, communities, states, nations, policymakers, community organizations, religious organizations, healthcare organizations. It cuts across the fabric of society and has the potential to absolutely make the world a healthier place in a very collaborative, cooperative, and non-judgmental fashion. The fundamental notion is that by improving health literacy, people will be empowered to take charge of their life, make an informed decision, and in the aggregate, more and more informed decisions will produce a healthier population. It doesn't mean that it's dogmatic in the sense that it tells people what to do, but it is an insistence from a respectful place that an informed decision is in fact the better way to make a decision than often happens in individuals' lives and communities. The challenge, of course, is that people face pressures on multiple fronts. They'll work 1 to 3 to 5 jobs. Their income may be low, it may be high. They might have developed addictions to substances to help them cope with life, and that can happen across the spectrum. They may be in a situation where access to healthcare is simply difficult to obtain, sometimes because of financial costs, sometimes because of geography. They may just live far away from a hospital and are forced to be a little more self-reliant when it comes to taking care of their health. But across the board, the data that we've collected really strongly indicates that if you improve health literacy at a population level, a community level, a state level, that in fact you're going to, in the aggregate, have a healthier population. And what does that mean? It means that people can be more productive. It means they can be happier in their lives. It means that they can actually begin to aspire towards what the Ottawa Charter saw as health as a resource for life, not the outcome of living. When people are healthier, they can simply do more of what they want in their life because they have to spend less of their energy combating sickness. And in the end of the day, we think that's an important outcome.
The way I think about health literacy is I think about it like it's a balance. And it's almost like a state of being. So health literacy is when people who are seeking health or healthcare services, their abilities, desires, needs match up with people that they're working with. And of course that happens in an environment. And of course the world I work in is primary care, outpatient care. So I work with individuals and families who are needing to get services. So health literacy to me is when we are on the same page together, when I'm able to communicate, they're able to understand and use the information to meet their own needs.
We can't really think about health literacy without first thinking about literacy, because health literacy is a type of literacy. So you've heard terms like computer literacy and science literacy and financial literacy and now health literacy. These terms imply how literacy enables a person to function in some social context. So health literacy enables a person to function in the health arena, to participate in health care, self-care, and caregiving. These terms also imply the concept of multiple literacies. So this concept says that everyone watching this has at one time many literacies at different levels of proficiency. And each of your literacies is a personal and community asset that you've developed over time with need, opportunity, resources, and support. At the foundation of each of your literacies are basic literacy skills, the 3 R's, reading, writing, and arithmetic. These are foundational skills that are needed to gain knowledge and use knowledge. So it's not surprising that any way that we define literacy and define health, and no matter how we measure them, health and literacy are inextricably linked. More literacy translates to more health and to more options and opportunities to regain, maintain, and improve health. So every organization that seeks to be a health literate organization should consider its duty to lead their community in adult literacy services as primary prevention and as a means to increase the effectiveness of everything else that those organizations do. To look at basic literacy as the foundation for a healthy society, a pathway out of poverty, and the key to the advancement of women in society.
Health literacy to me means the ways in which people and systems and providers interact in the context of health to make meaning of particular health situations. I think that for individuals, it's very tightly tied to their ability in general to make meaning of symbol systems. And I'm using the term symbol systems very deliberately because I think the term literacy has been very tightly tied to reading, writing, speaking, and listening. And I think in most of our cultures today, it's the way of making meaning that we privilege. But I think that in fact, as we do international assessments, for example, we include numbers, and they've assigned the term numeracy to it. In the past, somebody who was a teacher of literacy would not have thought of themselves as teaching mathematics in any way. We also use the term today in terms of working in computerized environments, and I'm going to distinguish that from what's being called computer literacy. I think that when literacy is combined with other terms like health literacy, financial literacy, computer literacy, it has to do with the ability to make meaning in a particular context. So health literacy is certainly bringing all of those skills into a health context, but I think it's also involving the ways in which people can lead the healthiest lives, achieve well-being, manage their lives, make choices, and we think that literacy skills are very essential to those in today's world. But I also want to say that I think that the ways in which we think about literacy are shifting today. With the ways we're working, we're returning once again to an environment where there's far more oral interaction. There are many people who've come from oral cultures. And if you came from an oral culture and weren't reading, then all your interactions with yourself, your community, your providers, your family would have been through talk. And I think that with some of the new technologies, we're getting to a place where we're combining print and talk and visuals, and we're looking at the understanding of symbols that are other than pure print, and all of those things have to be taken into account when we think about what constitutes literacy, because when people go into a situation and have to make decisions about their health, have to deal with a health crisis, have to maintain the well-being of themselves or their families or contribute to their communities, they need to be able to make sense of all the various symbol systems that are around them that are being used in those contexts. So I think health literacy is an extremely complex construct that's a combination of the issues that we bring from literacy itself, understood very broadly as multiple literacies, and from a health context where we're talking about communication and the ability of systems to respond to the needs of individuals. I think that systems need to make some dramatic changes in which in the ways that they communicate. They have to find other ways of practicing. Providers have to find other ways of practicing. And it has to very much involve interactions and, I guess, partnerships and collaborations among the various players, because it can't be one-way transmission of information. For me, health literacy provides some new opportunities and new challenges to think about the ways in which people can live their lives more effectively, be healthier, maintain their well-being by bringing to bear all these various skills, but also by working in systems that are responsive to them and have been designed in ways to respond to the needs.
Okay, so chronic disease management, the public now has access to tools that they've never had access before. They've also got access to the world in a way they haven't had before, particularly through social media. That's changing the complete way we understand health literacy as it's expressed online. It's now mobile devices, it's tablets, it's computers, it's desktops, it's absolutely everywhere, it's almost ubiquitous. And what that means is it means that we're changing some of the ways in which the public talks to each other, the way they talk to their health providers, the way providers talk to each other, and the way scientists and policymakers are also brought into the equation. We've never had to deal with that before, and the literacy skills that are part of that are quite profound. People need to know how to find information, they need to know how to appraise it, they need to know how to act on it, and they need to know where to go to act on it, and what tools to do that. So it's really changing the way we understand health literacy. It's an exciting time for researchers, but it's also pretty scary for how we make policy recommendations, what we do as practitioners. I think really one of the fundamentals is that we just need to be engaged in this topic. We need to think about it, be mindful of the tools we use and who we're connecting to and how we're connecting the world with those tools. Being able to train people on how to think about these tools, I think, is going to have much more profound effects on how people manage and prevent chronic diseases than it is on just the tools, although that's important. Those tools are going to change over time, and the skills that are enabling people to use those tools are changing as well, but it's really how we think about these tools and technologies that I think are going to fundamentally have an impact on our health system and have an impact on people's well-being.
Health literacy to me means the ability to enhance the awareness and understanding of taking care of one's health. For example, chronic diseases are increasing in Canada and in all populations, and what effective management of chronic diseases relies on participants or patients to engage in their self-management, understand how their care, their self-care, relates to their disease and their outcomes, and whether this can improve their outcomes or make them feel worse. Particularly in my research, I'm looking at bringing services to people who don't have access to chronic disease services. For example, in large urban areas, we have things like cardiac rehabilitation programs, diabetes teaching centers, kidney clinics. But in small urban areas, in rural areas, people don't have access to those types of care. So we're using telecommunications technology, and primarily the internet. We're creating these specialty services and communicating with patients in their homes and in their communities, and linking them with their family physician so that we can support patients in their self-management, bring the awareness and understanding of how they feel relates to how well they're doing and what they can do better through supports from their nurse, their family physician, dietitian, care providers, and so forth. And what we're working on is to make these programs and these models of care as accessible as possible to patients throughout British Columbia, so that regardless of where people live, they can access care at any time and anywhere.
And part of what my passion is to help people to be able to access resource and self-manage, because this is tied to the long-term outcome of the health. And health literacy is certainly an important component for people to be able to access the resource that is needed, the information that is needed, and also to make good decisions about their treatment. So some of the work that we are doing is to create what we call patient decision aid to help individuals to make informed treatment decisions.
Health literacy has to do with the demands that are put on people in the health situation and their skills, the fit between those two factors. So it's not just a matter of individuals not having skills, it's also a matter of the system not appreciating the requirements that they're putting on individuals. People who have low health literacy skills are much more likely to experience chronic diseases and much less likely to be able to cope with those chronic diseases using chronic disease management approaches. So it's very important to make sure that the information that people receive in that kind of situation fit the kind of skills that they bring to the situation, so that they can actually understand, evaluate, and communicate health information adequately, and use that information in order to help them use chronic disease management.
I think health literacy is about giving, from my perspective as a doctor, is about giving patients that come to see me and their families an understanding of the reasons they've come to me and beginning to understand some of the symptoms or presentations they've got, and then thinking about if they have got a mental health problem, how can we work with them to try and prevent that happening again. And it's about giving them the not just information but the skills, and getting them to think about all the factors in their lives that might have led them to come to see me in the first place, and deconstructing some of that to make it relevant and make sense to them.
That the relationship between health literacy and health outcomes, particularly in terms of intermediate outcomes, has been established, meaning people's ability to take care of their own health, to adhere to treatment patterns, and to perform behaviors that would assist them. We're particularly talking during this conference about chronic health conditions and its relationship to health literacy. When we looked at the literature, we identified 35 interventions that were related to health literacy, which is not very many. I think that more work needs to be done in that area in terms of different health conditions and different approaches that can help individuals who have deficiencies or lower health literacy.
Well, chronic disease is primarily managed by patients and their families. So when we think about health literacy, we have to think about the kinds of skills and support that they need. And when we think about managing chronic disease, it is highly culturally dependent. So that, for example, if someone has diabetes, how they will manage and handle that diabetes in the community will differ considerably depending on the culture that they come from. If you think about trying to change the diet for a person with diabetes, well, one of the things we need really to be concerned about is how culture affects their diet, how they will take information about their diet and use that in their day-to-day lives. If we think about marginalized communities, for example, their ability to be able to purchase the kind of food that is recommended for them may differ. If we think about culture and the place of pharmaceuticals in that culture, how they'll handle their medication regime may be quite different. So culture is extremely important when we think about chronic disease and providing support, health literacy supports for it. So to be successful with health literacy, we have to be culturally competent. We have to have organizations that are culturally competent and will support the differences that we see in the culture of the people that we're working with.
I'm interested in health literacy because when I'm trying to communicate with my patients about their asthma and their chronic obstructive lung disease, it's very important that I speak to them in a language that they understand, and that I also develop educational material that they can understand to improve the control of their disease. Among clinicians, they don't often take account of the fact that people come from different ethnic and cultural backgrounds, and that they also have different levels of health literacy. The exciting thing about this conference is that we're taking groups of people who have expertise in health literacy and literacy generally, and then we're making them or allowing them liaise and work with clinicians like myself so that we can come up with better health interventions to improve chronic disease management in Canada.